Hi, everyone. Welcome to First Look. Katie Couric is, busy working on another story right now, so you're stuck with Bill Owens, the senior broadcast producer. But we have a special guest star, Dr. Jon LaPook, who this week is going to start a series, a heart series that we're calling Matters of the Heart. We'll be right back to you, Dr. LaPook, just 1 second. We have a number of stories that we're working on this evening. We'll just give you a sort of a quick flavor. We're going to check in with Lara Logan, who's in Iraq a day after another horrific bombing at Baghdad University, one of the oldest universities in the world, in fact. But over 40 students were killed yesterday there. Lara has a piece where she talks to a lot of the students who have lost classmates, etc. We'll also do a story on Al Gore, and Al Gore is probably the first politician to really make global warming his issue. And he took a lot of slings and arrows over the last 10 years or so, but last night after winning an Academy Award, and you take a look around and a lot of politicians are going green and getting credit for it. So we'll have a look at that as well. But back to our star, the doctor.
Over the last few years, it's been amazing what's been going on, the trend in medicine, which is the miniaturization of surgery. So it's not exactly Fantastic Voyage, where things get shrunken and down, put into the veins and arteries of the bodies, but we're kind of getting there. And tonight we're going to be talking about a new type of a procedure where if somebody has a heart valve that's in trouble, that's damaged, instead of having to crack the chest, which is what we always used to have to do to replace it, you can actually slip a catheter in through the groin, wind it up to the heart, and use this fancy schmancy gizmo to pop in a new valve, basically, without having to crack the chest. It's amazing. What's interesting about tonight is it's a mother-daughter pair. Oh, wow. So the mother actually had the same exact valvular problem. She had her chest cracked, and the daughter saw the hard recovery, which took over a couple of months to happen, and for her to be completely back to normal again. And then, lo and behold, the daughter turns out to have the same valvular problem and is just terrified at the thought of having to have her chest cracked. So what does she do? She surfs the internet, and she comes up with a place that actually does this non-invasive, less invasive procedure. And we don't want to give it all away because we want you to tune in tonight to see what exactly happens.
But hopefully this is also instructive in terms of people who themselves or their family may have this sort of problem or other heart problems. It's another option for them to look into. And that's what we hope to do tonight, is just bring you a little bit more information. So for Dr. Jon LaPook, I'm Bill Owens.
I'm Dr. Jon LaPook. This is the CBS Evening News with Katie Couric.
We'll see you tonight.